Good afternoon. Good afternoon. Thank you so much for tuning in. You are listening to What's Going On. My name is Dr. James Gilmore, and I want to thank you for tuning in to What's Going On, where we talk about what's going on in our community, the state, the nation, and the world. We've had some great discussion today about the School of Nursing, about the challenges with health disparities in the minority community. And we've talked about the need for more minorities to go into the field of medicine and apply to the School of Nursing, where it is an award-winning institution where graduates have jobs and make great careers. So I'm pivoting just a little bit now to really talk about our health, to talk about opportunities for us to live a healthier lifestyle. And I have some great guests. I have Miss Jamie Cyprian, who has joined us today with
Louisiana Campaign for
Tobacco Free, as well as I have someone that I've worked with before when it comes to health, and that's Miss Bianca Coates. Thank you so much for joining us.
Thank you for having me.
Absolutely. So let's talk. What are we doing well when it comes to taking care of our health, especially the minority community, and what are some things that we can do better?
I think right now we're realizing that we need to get checkups annually. Mm-hmm. And, before, it's been a stigma that we don't go to the doctor just because of studies like the Tuskegee, with the men and the studies. And, we're just kind of nervous about going to the doctor. But I think we're realizing now that we need to go to the doctor every year. Mm-hmm. We need to get blood work done. And especially knowing our family history. If we know that our family had diabetes, high blood pressure, whatever the case may be, we know now that we need to make sure that we, check that more often.
So, and I'm a victim of, I'm guilty of this. What do we have to do to get us to go get more checkups? Right now we have Obamacare.
Right.
So everyone has access to be able to afford some type of health care.
Right.
But just having the insurance, I know folks who have great health benefits who still, I have to say, you need to go to the doctor. Mm-hmm. Is there anything that we can do to motivate our people to understand that going to the doctor helps prevent
correct
major illnesses?
Right. And we really don't want to wait till something bad happens.
Right.
It's key and it's important that we go as a preventative measure. We don't want things to happen and then we're like, oh, wow, we got to go to the doctor now.
Right.
So we need to prevent this from happening. And that means, not just going to the doctor, but just eating healthy and exercising.
Right.
That's a preventative measure in itself.
So tell us about, you're a dietitian by trade,
right,
correct?
Yes.
What's your definition of eating healthy?
Eating healthy is a balance.
Okay.
It's definitely a balance in moderation. We can't just be like, only eat this and it'll make you healthy because everybody's different. And there are different fad diets and different things that we can try out there. But of course, those are things that just simply come and go. And so, but what we know that's truth is that eating fruits and vegetables comes from the earth.
Well, let's stop right there. Because at one time someone told me eat fruits and vegetables, and then I read somewhere where fruit has too much sugar in it. So, was I right or wrong for eating all those grapes? Okay? I'm trying to eat the grapes. I'm trying to eat healthy. And then someone says, oh, you're eating too much sugar now. What are your thoughts about that? Am I the only one that have heard about that, fruits and vegetables are great, but they're loaded with sugar?
Yeah, of course, all fruit have some sort of natural sugar.
Okay.
But we need them. It has vitamins. It has phytochemicals.
So it's better than the processed sugars is what you're saying.
Yes. Natural sugars that you're going to get from your fruit is going to be much better from getting something processed like juice. Because they have literally taken that whole fruit, processed it into a juice. They've added sugars, fats, whatever it may be. And now you've lost all the nutritional value that it offers.
Gotcha. And we have a serious problem with loving juices in our community. Yeah. Kool-Aid. I can name a few others.
Yeah.
And so it's filled with processed sugars and additives that may not be good for us.
Right. And so like right now, I am drinking a pressed juice.
Okay.
But it's simply fruit.
Gotcha.
That's it. and they may have added a vegetable in it, and of course that helps as well.
And to give a little flavor.
Right, right.
Let's talk about smoking.
Yes.
Ooh, it's smoking up in here.
Hope not.
The information is smoking.
Yes.
You are here to tell folks what about tobacco?
Well, I am with Louisiana Campaign for Tobacco-Free Living, which is a program of the Louisiana Public Health Institute and also the Louisiana Cancer Research Center. So we try to combine research with what's in the community. And so I am here to, today is actually World No Tobacco Day.
Okay,
and
I didn't know that.
we're encouraging people to quit smoking.
Quit smoking.
Even if it's just for today to start that commitment. And so
Okay.
we have resources available. But what's interesting is that when we talk about fruits and vegetables, that's one thing that can help people when they're quitting smoking. To replace their smoking habit, eat more fruits and vegetables. They can
Okay.
eat things like popcorn and other nutritious things. The theme for World No Tobacco is grow more food, not tobacco. And so we want to encourage people to, instead of using tobacco, use food. Get those fruits and vegetables. Be
Healthy
healthier.
foods.
Yes.
Yeah.
Okay. And you correlated it to cancer.
Yes.
So
Food is related to cancer. Also, tobacco use definitely related to cancer. Directly related to lung cancer. Louisiana is top in the nation with lung cancer, and 90% of lung cancers are due to smoking.
smoking.
Yes, and also secondhand smoke. Do not forget about secondhand smoke. So in that vein, I do want to talk about how policy works as well. We have policies across the state that encourage no secondhand smoke indoors. And so like in Baton Rouge, if you notice in the casinos, you can't smoke inside. They have nice areas now where they can smoke outside, like on a patio, but not inside,
Yeah, I
even in the
remember that
bars.
debate.
And that happened actually 5 years ago. The anniversary is tomorrow.
And are we, well, good. Are we comparing data? Is it helping?
It's helping. Our rates are slowly coming down.
But slowly.
But we still have populations such as African Americans, people with low socioeconomic status, LGBTQ+, people with mental health disorders that have higher rates of usage. And so we're definitely trying to reach those populations as well to get them to stop using.
Yeah. Why do people smoke?
A variety of reasons. It's accessible. A lot of times, you know, as kids growing up, they used to send kids to the store to get their cigarettes.
Pack of cigarettes.
And now, even with vaping products, you find that parents are providing vapes to their youth because they're not educated about all the dangers. They
Parents
think
are
it's,
providing vapes to their kids.
we find that parents, they think it's better or safer than smoking.
And vaping isn't safe.
And it's not safe.
Yeah, I think it might have been online. And again, you can't believe everything you see on social media, except what's going on with Dr. James Gilmore. You can absolutely believe what goes on here. But I saw this image of like a vaping or a hookah lung and a normal lung, and so those are not. It's just as bad as tobacco, is what you're saying.
Yes, because you're inhaling heated toxins and particles.
And some folks, when I ask them what's in there, a lot of folks don't know
They don't
what
know.
they're
idea.
smoking. in those hookahs.
The companies might not know, to be honest with you. And
So
you
is
will
it to
see,
look cool?
You will see some information about a condition called popcorn lung. There's a chemical in vape that is called diacetyl, which inflames the lung, and it looks like popcorn.
Wow.
And it used to be manufactured. Popcorn had the same chemical, but it's been banned in that
so
popcorn.
now they put
but
it in
now
vapes
it's in
and-
vaping. In vapes.
Wow.
So it makes you wonder if people really don't want to see people live long and healthy lives.
I think there is money in
Oh
us
yeah,
not being
yeah.
healthy.
There's money in health. Yeah, and there's money in medical care.
In medical
too.
care. So as Bianca said, being preventive is the best way, and we do try to promote more cancer screenings, especially lung cancer screenings. We will be doing more outreach in community about how to get screened for lung cancer and what's available.
Good. With the School of Nursing Dean, we talked about the mobile unit, and they offer cancer screenings on their mobile unit, especially in areas where it's hard to access.
And you asked how can we get to the people, and that's what we need to do. We need to go where people are. We can't just sit in our 9-to-5s. We have to be at the events. We have to be, if we have to go in front of Walmart, we have to go in front of Dollar General or talk to Dollar General, those places that people gather. We need to be there with them.
Exercise. How often should we do it? And its benefits. Ms. Bianca?
So 30 minutes a day for adults. Children, it's going to be an hour a day.
More for children?
Yes.
Why
more
is
for
that?
Children. Well, they're growing. They're strengthening their bones, their muscles.
Okay, for strength.
Right. We're grown, of course. We don't need it as often, but, it's good to do more than 30 minutes. But that's the key, 30 minutes a day, 150 minutes a week.
Okay. And I think that's something that we as humans can make time for. That's a lot. Do you work out 30 minutes a day, Miss Jamie?
I do.
I do.
I had a
You
knee
don't
injury.
smoke, huh? But
I had a knee injury recently, so I
Gotcha.
haven't been, but
Gotcha.
I try.
But I'm sure there have been proven health benefits to both exercising as well as eating healthy, right?
Right. Yeah, definitely bone strength, gaining those muscles, healthy muscles. And, of course, just always promoting circulation in your body. It's great for your heart.
So
whole
we're here
body.
at Southern Coffee, a place where you can get a chicken salad sandwich, a nice pressed, a fresh smoothie, and it has healthy fruit and vegetable options. Many places in urban minority communities, as stated earlier with Jamie, we have corner stores where there's liquor, there's cigarettes, and there are pig feet and pig lips, and potato chips and cookies.
Right.
What's a person to do that lives in a community where they lack good, healthy food? And going back to policy, do we need to call upon our elected officials to do more at addressing the quality food deserts in our community? Your thoughts?
Definitely. I used to work for the Ag Center, and we make sure there were like mobile units, and they're now putting community refrigerators in low socioeconomic communities.
What's a community refrigerator?
Well, basically, it's a refrigerator that's in a community, and someone comes in and adds different foods for those that may not be able to afford.
I'd like to
healthier.
explore that. I think that might be a great idea for some areas I know about.
Yeah, definitely.
Okay. That way folks have options.
Correct. Yeah.
Any thoughts about eradicating, I know you're here to talk about anti-smoking, but any thoughts about eradicating some of our food deserts so people have more options than just liquor and cigarettes? And
Again, advocacy, getting people engaged in their own community politics. So your zoning boards, so that businesses that come in, you want to see, okay, it's not all liquor stores, it's not tobacco. What are these other businesses we need in our community?
Right.
Because the community members are experts in their communities.
Right.
So look to the community members and don't always come in and say what they need. What do they need?
Right.
And ask them.
And then also realize that some of our communities have gone so long being neglected that they may not know what they need.
Right.
They may not know that there are quality food options in other communities and that what they're eating isn't fair to them.
Right. And I really think it all starts with just grassroots. Get on the boots on the ground and just definitely seeing what these communities need and going after it.
Absolutely. So let's shift a little bit to careers. How does one become a dietitian?
So you want to start off by getting...
And what does a dietitian do?
So a dietitian is someone that helps someone to change their behaviors and how they're eating. A lot of times we have traditions of how we eat certain foods, and Big Mama cook food like this, and so we're going to eat like this, but it's not always the healthiest way. So of course, what a dietitian does is to help you to show you how to eat healthier, how to change that mindset of how to make things a little healthier. And so you want to major in dietetics or nutrition at a university, and then you're going to go on to get an internship, which is your 5th year, and then you take a board exam, and then you're able to get a license to become a licensed dietitian nutritionist.
Okay. And how do you get paid? What jobs are out there? Do you work in restaurants? You work in school districts? Where do you apply for jobs as a dietitian?
Yes, so definitely right now I'm actually a director of child nutrition. And so you have that option, child nutrition, of course, restaurants, grocery stores. You'll most likely see dietitians in a hospital in a clinical setting just trying to help people to learn how to eat healthy and to not come back to the hospital.
Right. So dietitians are great to help plan a healthy eating lifestyle for individuals, or you work through companies or you work for yourself as well as the district.
Well.
But you can also, with that license, do independent work.
Right.
Do you see hope as it relates to the health disparities that minorities have to face with obesity, with lack of quality food options? Where are we headed, Ms. Coates?
Like I said,
Because I can name 7 people over the past year that have had strokes. I know multiple people who have high blood pressure. And sometimes, but yet we're still boiling crawfish and eating the salt. We're still, you know what I mean, eating the sugars. So, give us some tips on what do we need to do.
I wish I can just help us to just not want to eat those foods all the time. And I know, like I said, it's tradition. We've eaten it for years. We're so used to eating it, and it's so hard to break those habits sometimes. But again, education. We have to get out into the community.
And we have to let people know the dangers of what they're eating.
The dangers.
I think that may be a good approach. Is that I think more so we need to let folks know the dangers of what they're eating, the dangers of vaping and the dangers of smoking more. Because again, if this is all they know, then that's all they'll do.
Right.
And what we know is culture shifts take years and years to change.
But
If we look
unfortunately,
at-
in those years, people die.
People die.
Right.
We look at 1965, when we started knowing that tobacco was toxic, and where we are now, we've made a lot of progress, but it took 40 years. You can even think about seatbelts and things like that. It takes years now you just buckle up, not even think about it, but it wasn't always like that. And so we're doing the work and we're making small progress, but it's definitely
It's
a
massive.
culture shift.
Yeah.
Right.
Yeah.
Yes.
Definitely.
Okay. Any closing remarks that you'd like to say to those related to your Don't Smoke Tobacco campaign, and anything you'd like to say to the listening audience, Ms.
Yeah, I
Jamie?
want to give them resources for if anyone wants
Please.
to quit or you want to help someone quit, they can always call 1-800-QUIT-NOW to get services, or go to our www.quitwithusla.org website for vaping, vape-free information. They can text vape-free to 873-373.
Gotcha. So
And
there
we
are-
also do have a text line. We can text READY to 34191.
So if you're ready to quit smoking and you need a little assistance, or you want to stop vaping, and you need a little assistance because it's proven to give you cancer, it's proven to do serious damage to your lungs, we have resources out there to help you. Okay.
Yes.
And Ms. Coates, any resources or information you'd like to share to folks who just want to eat better and live healthier?
Yes. And I know there's a lot of different resources out there. There's so many things on Google that you can look at as far as dieting, and it's not always correct. So you want to look into research-based websites, and like eatright.org is a great one. American Heart Association, American Institute for Cancer Research. Those are some really great resources for you to check out as far as finding a balanced diet, finding just some balance. And I'm not a dietitian that says you can't eat that, but just maybe eat those traditional foods, but learn how to cook it in a healthier way.
Right. And go to the doctor.
Right, and go to the doctor.
Get your checkups, get your screenings.
Exercise.
Do what's necessary,
Yes.
Exercise. Thank you all so much for coming on the show, enlightening us about how to live and eat healthier, especially without tobacco.
Yes.
It's been a pleasure, and wish you all best of luck in your endeavors. And hopefully, listening audience and those watching on social media will share this podcast on their social media so that others can get motivated to not smoke, not vape, not use tobacco, and to eat healthier, go to the doctor, and exercise. Again, you're listening to Dr. James Gilmore with what's going on, and I thank you so much for tuning in. Have a great rest of your week. Take care. Thank you.